Every week in clinic, I get asked one question more than any other. Doctor, should I take Mounjaro or should I have weight loss surgery? If you've been struggling with your weight for years, this may become one of the most difficult and emotionally exhausting decisions you will ever face. And the more you research, the more confusing the decision becomes. Some people say GLP-1 medications are replacing surgery. Others say surgery is still the gold standard. Some say start with a medication because it feels less invasive. Others say don't waste your time. Go straight to surgery if you are looking for a long-term solution. And the last thing you want is to spend years following the wrong path, only to realize later that another option may have been far better for you. So how do you know which option is right for you? I am Dr. Almerie, consultant weight loss surgeon and obesity specialist. For years, I have helped people with obesity make this decision, and that's exactly what I hope to help you do today. In this video, I'm going to share the framework I would want someone to take me through if I were living with obesity and trying to decide between GLP-1 medications and surgery. This video is based on the best available evidence, together with what I have learned from treating thousands of patients over the last decade. By the end, you will understand how GLP-1 medications and surgery compare for weight loss and managing type 2 diabetes, one of the most feared complications of obesity. You will also understand where each treatment currently performs better and the crucial questions you still need to answer before deciding which option may be right for you. Let's dive in. Before we compare GLP-1 medications and weight loss surgery, we first need to understand one very important thing. Why is obesity so hard to treat in the first place? Many people think obesity is simply about eating less and moving more. Well, if that was true, far more people would succeed in losing weight and keeping it off. But they don't. The truth is, obesity is driven by two powerful forces: your biology and your environment. Biology is the part you don't choose. It includes your genes, your hormones, how hungry you feel, how full you feel if you eat, and even how strongly your body fights to regain weight once you lose it. Research suggests that these inherited biological factors account for a big proportion of the differences in weight between people. And that's exactly where GLP-1 medications and surgery come in. They work by changing these biological signals and regulate hunger, fullness, food cravings, and ultimately your body weight. When these biological signals move in your favor, controlling your weight becomes far more achievable. Then there is your environment, the food around you, the way you live, your sleep pattern, your stress levels, your daily habits, and how easy it is to consume more calories than your body needs. Every day, that environment is constantly interacting with your biology. It can trigger hunger, increase cravings, encourage overeating, or make healthy choices much harder. That's why obesity is never just biology or just the environment. It's the interaction between these two. And once you understand that, it becomes much easier to understand why changing biology is often essential, but changing biology alone is not always enough. So where do GLP-1 medications and weight loss surgery fit into all of this? The answer starts with understanding how each of them actually works. Let's explore that. To understand how these treatments work, you first need to understand one thing. Your body has its own appetite control system. Every time you eat, your stomach, your intestines, and even your blood sugar send hormonal signals to your brain. Your brain reads these signals and turns them into appetite messages. I am hungry. I am full. I need more. I've had enough. So if you change those signals or change how your brain responds to them, you change your appetite. Now let's start with GLP-1 medications like Ozempic, Mounjaro, or Retatrutide. For simplicity, I will refer to this wider family as GLP-1 medications, although some act on more than one hormone pathway. GLP-1 is a hormone your body already produces naturally every time you eat. Its job is to tell your brain, food is coming. You can ease off on the hunger. So when you take GLP-1 medications, you are amplifying your body's natural satiety signal. As long as the medication is present, those feelings of fullness remain stronger. So eating less starts to feel more natural, instead of feeling like a constant battle. Weight loss surgery achieves the same goal, but in a very different way. As surgeons, we obviously change the anatomy. But what many people don't realize is that some of the biggest effects come from the hormonal changes that follow that. The two most common operations are the sleeve gastrectomy and the gastric bypass. With the sleeve, around 80% of the stomach is removed, leaving a narrow tube-shaped stomach. That means you feel full much sooner. But that's only half of the story. The surgery also removes the area of the stomach that produces most of the hunger hormones. So you are not just eating less, your hunger is often much calmer. Now with a gastric bypass, we create a small stomach pouch, about the size of an egg. Then we connect that pouch directly to a lower part of the small intestine. So food takes a shorter route through your digestive system. And this changes how quickly food would reach different parts of your gut. And that changes the hormonal signals your gut sends to your brain, making you feel fuller and less hungry. So a gastric bypass is not just creating a smaller stomach, it also changes the hormonal signals that help drive weight loss. Now, even though one treatment is an injection and the other is an operation, they are both trying to influence the same appetite control system, but in different ways. And that raises the next big questions. How much weight each treatment can help you lose? How well each one reverses serious obesity-related diseases like type 2 diabetes? And how long-lasting their effects really are? Because that's exactly what determines which treatment is more likely to be the right choice for you. So let's explore that next. The first question I almost always get in clinic when patients are deciding between GLP-1 medications and surgery is, "Doctor, which one will help me lose more weight?" And that's exactly where we will begin. Now, rather than talking in percentages, let's make this real. Imagine someone who is 170 centimeters or 5'7" tall, weighs 120 kilograms or 265 pounds, and has a body mass index of just over 40. A very typical patient I might see in clinic. Now, your numbers may be different. Some of you will weigh more, some of you will weigh less. But to keep things simple, let's use this patient as our example and compare what they could realistically expect on average from each treatment based on the best available evidence. Let's start with Semaglutide. You might know it as Ozempic or Wegovy. On average, people lose around 15% of their starting weight. For our patient, that's around 18 kilograms, reducing their weight from 120 to 102 kilograms. Now next comes Tirzepatide. You may know it as Mounjaro or Zepbound. Average weight loss rises to around 20%. So for our patient, that's around 24 kilograms, taking them down to 96 kilograms. Then comes surgery. A sleeve gastrectomy typically produces around 25 to 30% weight loss, taking our patient to somewhere between 84 and 90 kilograms. A gastric bypass usually performs even better, around 30 to 35% weight loss, taking them to somewhere between 78 and 84 kilograms. That's a difference of more than 40 kilograms or nearly 90 pounds from where they started. So as things stand today, weight loss surgery still produces the greatest average weight loss. But that may no longer be the whole story, because now a new GLP-1 medication is likely to arrive soon. It's called Retatrutide. Retatrutide is not yet licensed for clinical use. It's still in clinical trials, but the results so far have been remarkable. Average weight loss has reached around 24%, and in some recent trials, results approach 29% for those at the highest doses. So for our patient, that means losing around 29 to 35 kilograms, taking them down from 120 kilograms to somewhere between 85 and 91 kilograms. Think about that for a moment. Those numbers are no longer simply competing with older GLP-1 medications. They are now overlapping with the results we have traditionally associated with weight loss surgery. But based on everything we know today, GLP-1 medications still do not consistently match the weight loss we see with the most effective weight loss surgeries, especially for people with higher weights and higher BMIs. Because the higher your starting weight, the more weight you may need to lose to reach a healthier range. For someone with a lower body mass index, a GLP-1 medication may provide all the weight loss they need. Even Semaglutide or Tirzepatide may achieve an excellent result. But for someone with a much higher body mass index, the difference between losing 20% and losing 35% of their weight can be enormous. It may be the difference between remaining in severe obesity or moving into a much healthier weight category. But weight loss is only part of the story, because obesity is not just a disease of weight, it's also a disease of metabolism. So the next question is even more important. Which treatment does more for your health, your metabolism, and your chances of putting the most feared type 2 diabetes into remission? Let's explore that next. Weight loss is certainly very important, but for many people, the real reason they are trying to lose weight is not the number on the scale. It's what that excess weight is doing to their health. And perhaps the biggest concern for many people is type 2 diabetes. The diagnosis, the daily medications, and the fear of complications including damage to the eyesight, heart disease, and kidney failure. These are the worries many of my patients bring to the clinic. So which treatment works better for type 2 diabetes? First, we need to understand the difference between better diabetes control and diabetes remission. For type 2 diabetes, remission means your blood sugar has returned to the normal range without needing diabetes medication for a sustained period of time. You can think about it as diabetes has been cured. Although we do not use the word cure for chronic diseases like diabetes, as they have the risk of coming back. That's much higher standard than simply having a better blood sugar control. Let's start with GLP-1 medications. These medications were originally developed to treat type 2 diabetes before their weight loss benefits became clear. So it's no surprise they are excellent at improving blood sugar control. But achieving a true diabetes remission is less common. The best available evidence suggests around 6% of patients who are taking GLP-1 medications achieve type 2 diabetes remission. But that does not mean the medication failed for everyone else. Many patients with diabetes still achieve significant improvements with the blood sugar control, even without coming off diabetes medication completely. But surgery is different. For many patients, blood sugar starts improving within hours of surgery, before significant weight loss has even happened. And that is something I regularly see in my own patients. Soon after the operation, the diabetes medication may need to be reduced or even completely stopped. Of course, not every patient achieves remission. It's less likely if you have severe, long-standing diabetes or when insulin is already required. But even then, the improvement can be dramatic. Remember, surgery changes the hormonal signals coming from the gut, and that is one reason blood sugar can improve so quickly. In one large study, 58% of patients were still in complete diabetes remission 2 years after surgery. And at 5 years, around 47% remained in remission. Compare that to around 6% on GLP-1 medications, and the difference is striking. Although these are not direct comparisons, the overall evidence consistently shows a higher chance of diabetes remission after weight loss surgery. So, when remission is one of the main goals, weight loss surgery, particularly gastric bypass, still offers the better chance. But GLP-1 medications remain highly effective, particularly for earlier or less severe type 2 diabetes. So once again, it's about matching the right treatment to the right patient. But before you decide which treatment is right for you, there is more we still need to consider. Today, we have answered the first 2 questions I discussed with my own patients when comparing GLP-1 medications and weight loss surgery. Which treatment produces the greatest weight loss, and which offers the best chance of controlling type 2 diabetes, one of the most feared consequences of obesity. But do not make your decision based on this alone just yet, because we have only seen part of the picture. 2 huge questions still need to be explored, as both are essential before you make your decision. First, what happened years later? Does the weight stay off, or can people regain weight? And how does that risk compare between the two options? Because losing weight, celebrating, finally feeling free, only to watch that weight slowly return, is one of the greatest fears for anyone living with obesity. We are not just talking about the next 6 months or 1 year. We are talking about whether that treatment can continue to serve you and protect your health for years to come. Then comes the second question that could completely change the balance. What is the price tag for that weight loss treatment option? Because every effective treatment carries trade-offs, financial costs, side effects, complications, nutritional risks, and lifelong commitments. And those are exactly the questions we will explore in the next video. Because this is not a light decision. This may become one of the most important health decisions you will ever make. I am Dr. Almerie. Thank you for watching, and I will see you in the next video. Until then, stay informed, stay healthy.